Let's now have a look at the illness itself from data reported largely in the New England Journal of Medicine, again, the most prestigious of medical journals. We'll have a look at signs and symptoms of corona a doctor would observe, x rays, CAT scans, and lab tests. First, corona is not a severe illness for most of the population. Although these numbers may be smaller with the technologically advanced U.S. medical system, these were the observations in China. Critical, 4.7% requiring ICU care. Severe, 13.8%, with some requiring ventilator care. Mild, 80.9%. These symptoms may begin on average 5 days after infection. Here's how the symptoms rank. First, cough, fatigue, produced sputum, shortness of breath, muscle or joint aches, headache, chills, nausea and vomiting, nasal congestion. Complications. The most frequent complication was pneumonia and seen in 91.1% of patients. Of those, 3.4% developed acute respiratory syndrome and may have required ventilator support. Kidney, muscle, and coagulation complications all rank less than 1%. Age. Here's how severe illness broke down in terms of percentages found in each age group. Up to 14, 0.6%. 15 to 49, 41.1%. 50 to 65, 31.5%. Over 65, 27%. The common myth has been that young people don't get sick, but this just isn't true. At St. Thomas's in London, the young people who were at highest risk for the acute respiratory distress syndrome and required a ventilator were pregnant women, postpartum women, and those who are obese and with metabolic syndrome. In steeling yourself against the coronavirus, getting yourself into the best possible shape, lowering your weight, and normalizing blood sugar would be paramount. Radiology. 86.2% of CT scans of the lung were abnormal. 46.4% of these scans showed the typical ground glass look. X-rays were less reliable and were positive in 59.1% of cases and showed patchy infiltrates in 51.8%. So if you have a choice, the CT scan is the best indicator of disease. CT. Here's a close-up of the CT, which gives a far more detailed look than an X-ray. The hazy veil you see in parts of the lung is typical of viral infections that hit the lungs. These scatter and thicken as the disease becomes more severe. Lab. Lab results are not specific for the disease. C-reactive protein reflects the inflammation, and this is elevated in 60.7% of patients. D-dimer is also elevated at 46.4%, LDL 41%, and aspartate 22.2%. Pneumonia. How quickly does pneumonia develop? 3 days after symptoms and 0 days after diagnosis in the Chinese data. Risk. What is your risk of becoming sick? As you can see in the graph, the risk increases with age, at first slowly, decade by decade, then abruptly after age 60.